Has genetic testing been part of this study at all? In
Well,
terms of,
yeah.
specifically the genetic testing that, I forget what it's called, but is able to sort of identify which medications
Yeah,
may not work.
right.
What is there a name for that?
They just call the what they call the you know, it's just genetic testing for medication sensibility or sensitivities
Yeah.
and all that. It is good for that, but there's a piece missing about genetic testing. We all have probably, every one of us here have over 1,000 genetic mutations, okay, which made us different to each other. But genetic mutations does not necessarily have to create problems. Okay, they only create problem under certain circumstances, either through a physical stress or emotional stress or biochemical stress. So that's environmental. So when those things happens, that's why some people suddenly begin to have problem entering teenager or going to college or leaving home or lost parents under stress. That's when those genetic began to express itself. And then they cause biochemical imbalance. Okay. So by end of the day, it's not what genetic mutation you have determining what's going to happen to you, is what actual biochemical imbalance that is a result of genetics expression that going to treat the problem. So therefore, you can do all kinds of genetic testing. It doesn't necessarily tell us what they are actually translated into biochemical imbalance. So the best way still is to measure the biochemical balance in the blood using biomark because they are functional. And based on that, we gave you the treatment. So in this sense, you know, whether or not you have a genetic or not genetic, it's not necessarily relevant. As far as using genetic testing guide medical medication selections, I think there's some pieces missing in between, even though it is being promoted. Again, the reason is missing is that yes, you do have the genetic, only means you are more likely to have trouble with that medication. Doesn't mean you have to have trouble with that medication. On the other hand, even you don't have the genetic problem, and doesn't mean you're going to tolerate that medication better than others, because medication creates side effects not because of your genetics, because of what medication is, what it does. You see what I mean?
So do you have a way of measuring this imbalance?
We have a way of measuring the biochemical balance, the common ones, because we found this is not through me, it's through Dr. William Walsh's 35 years of research. And so that's what we're using to do that. Very simple blood work, just a few, couple $100 testing, and then we'll give you the answer, whether you have it, how you treat it. Of course, one thing we have to bear in mind, when you're on medication, it might suppress or change the results. So we'll keep that in mind when we interpret the test results.
So can that also be used as a sort of baseline?
Yeah.
I think you were asking about that earlier.
No, that's
a way to establish.
Yeah, that cannot be used. That's not going to be used as a baseline measurement. Again, your question.
So, who are your bigger supporters? Like, in other words, do you want, like, I'm a potential patient or a daughter or son of a patient. So, do you want a psychiatrist to be telling me this? Am I supposed to be researching it myself? Do you want my intern medicine doctor to tell me? Who do you want to support your the procedure?
Yeah, we want everybody to support us, and I think we get a referral from psychiatrists, therapists, nurse, primary care doctors, and of course, a patient does research themselves. I think for this kind of thing, due to the internet information access, I think patients get more and more direct access.
So if I was to Google depression, TMS is going to come up?
Yeah, it's going to come up.
Yeah, I
If
mean, I
you-
just happen to be fortunate because I
Yeah.
have other people that have talked about it.
Right.
But, I'm just trying to find
Yeah.
out, like,
If you search non-drug therapy for depression or new therapy for depression, TMS is going to come up.
okay. And then just one other question. How do you determine how much of the magnetic field goes into the head?
I think it's a perfect question for us to move to the next program.
Gonna do a
And
demo?
we're going to do a demo that will answer your questions. Thank you.
Thank you.